INIM, INICET important daily MCQ dose with Dr. Mahboob, that's me. This is a very important question as far as the INICET, NEET, PG and FMG is concerned, right? So what the question is asking, all are the features of the pathological myopia except A. Temporal myopic crescent, B. posterior staphyloma, C. Foster Fuchs spot, and D. pseudopapillitis. Okay, let me tell you that temporal myopic crescent is present in the myopia. Posterior staphyloma is a pathognomic of high myopia or pathological myopia. Foster Fuchs spot is a very peculiar feature of high myopia. So what we are left with, pseudopapillitis. It is because of the disc crowding, it is because of the small disc in hypermetropia which gives a feel of papillitis, but it is actually false feeling, right? That's why it's a pseudopapillitis. So the answer for this MCQ will be this one, right? It is found in hypermetropia, right? Now it's very important to understand what are all these options. Very important to understand what are all these options. So let me take you here that this 4 feature is very important and a feature of pathological myopia, right? What is happening when there is a high minus power of a myopic patient? The eyeball elongates like a balloon. When the balloon overinflated, it becomes thin. Likewise, when there is a high minus power of a myopic patient, our eye also elongate, and because of the elongate, the retina becomes thin. Sometimes what happens, there is an area disparity. There is a area disparity between sclera and RP choroidal complex, and because of that area disparity, this comes into play. This picture comes. And what is this picture? This picture comes. This is called temporal myopic crescent, right? Now coming to this picture, this what you see, this is a very abnormal thing, right? In the center we have the disc here, and all around this there is a ectatic bulging of the sclera because of the thinning of the retina and degeneration of the retina. So what is this? This is called posterior staphyloma, also known as Scarpa's staphyloma. And what is this important? Why is this important? Because it's a pathognomic of myopia, pathological myopia, right? Now, when there is a thinning, what is happening? When there is our hand becomes dry, skin becomes dry, there is a stretch mark. Similarly, when there is an elongation of the eyeball, there is a stretch mark also there in the retina. And this stretch mark, you can see here, this stretch mark, this is the stretch mark. This is called lacquer cracks. Lacquer cracks. And this is nothing. Why this lacquer cracks? It is because of the breaks. It is because of the break or breach in Brooks membrane. Because of the breach or breaks in the Brooks membrane. Now coming to this picture, this is posterior staphyloma. But what is this? This is the reddish nodular lesion because of subretinal hemorrhage or choroidal neovascularization, which is peculiarly seen in the pathological myopia. And this is what we call Foster Fuchs spot. So Foster Fuchs spot. So these 4 are the very important pathological feature of a pathological myopia. Thank you.